For decades, it's been a quiet fear tucked away in the back of many minds, especially for women. A whisper that turns a daily act of self-care into a moment of doubt. The question is simple, but its implications are profound. Could my deodorant cause breast cancer? Today, we're not going to traffic in fear or rumor. We're going on a 20-minute journey through science, history, and human biology. We will trace the origin of this widespread concern, break down the key ingredients under suspicion, and examine what the latest, most robust research actually tells us. Our goal isn't to tell you what to do, but to give you the clear, evidence-based information you need to make your own choice. The story begins not in a lab, but in our inboxes. In the late 1990s and early 2000s, a viral email chain letter began circulating. It claimed that underarm antiperspirants were a leading cause of breast cancer. The logic, as presented, was compelling in its simplicity. 1. Antiperspirants block sweat glands to prevent perspiration. 2. Preventing the release of toxins through sweat causes them to build up in the lymph nodes of the armpit. 3. This buildup poisons nearby breast tissue, leading to cancer. This theory tapped into several powerful anxieties: our fear of chemicals, our trust in natural bodily processes, and the very real devastating prevalence of breast cancer. It spread like wildfire, amplified by the new frontier of the internet. But as with any good story, we have to check the source. That original chain email? It was anonymous. It cited no studies. It was, in essence, a modern-day urban legend. However, just because an idea starts as a rumor doesn't automatically make it false. It just means we need to look much closer at the science it later tried to invoke: the suspects, parabens and aluminum. As the fear persisted, scientists identified two primary suspects in deodorants and antiperspirants worthy of serious investigation: parabens and aluminum. Parabens are preservatives used to prevent bacterial and fungal growth in a vast array of cosmetics, foods, and pharmaceuticals. The concern arose because parabens are weakly estrogenic. They can mimic the hormone estrogen in the body. Why does this matter? Some breast cancers are known to be estrogen receptor positive, meaning their growth can be fueled by estrogen. The theory? Parabens. Applied near the breast could be absorbed, act like estrogen, and potentially promote the growth of existing cancer cells. Yes, parabens have been found in trace amounts in human breast tumor tissue. This was a startling discovery. However, and this is a critical however, the study that found them did not compare levels to normal breast tissue or tissue from other parts of the body. Parabens are ubiquitous. We are exposed to them from many sources. Finding them in one place doesn't prove they caused the disease there. More recent comprehensive reviews have concluded there is no conclusive evidence that parabens in personal care products increase breast cancer risk. Suspect 2. Aluminum. Aluminum-based compounds are the active ingredients in antiperspirants. They form a temporary gel-like plug in sweat ducts, reducing sweat flow. The concerns here are twofold. 1. Estrogenic effect. Like parabens, some lab studies suggest aluminum salts can have estrogen-like properties. 2. DNA damage. Some in vitro test tube studies have shown aluminum can cause DNA damage in breast cells, which is a potential pathway to cancer. This brings us to a fundamental principle of science. What happens in isolated cells in a lab dish does not necessarily happen in the complex living system of the human body. Our skin is a formidable barrier. The amount of aluminum absorbed through the underarm is a tiny fraction of what we consume daily through food and water. Epidemiology is the science of studying health and disease in populations. It's our best tool for finding real-world links. Let's look at the heavyweight champions of epidemiology on this topic. The Nurses' Health Study, followed over 100,000 women for decades. Finding, no association between underarm product use and breast cancer risk. When we look at the totality of the evidence, the large, well-designed population studies, the signal simply isn't there. If underarm products were a major driver of breast cancer, we would expect to see a very clear pattern in these studies. And we just don't. Also, consider this. If the toxin buildup theory were true, we would expect breast cancers to occur overwhelmingly in the part of the breast nearest the armpit, the upper outer quadrant. While it is true that this is the most common site for breast cancer, that's simply because that's where the most breast tissue is. The distribution of cancer matches the distribution of tissue, not the pattern of deodorant application. This brings us to a crucial point in our public health dialogue: the importance of focusing energy on known, modifiable risk factors. The science is clear that deodorants are, at worst, an unproven concern. But we know, beyond a shadow of a doubt, what factors significantly increase breast cancer risk. Asterisk, being a woman and increasing age. Asterisk, 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 family history and inherited genetic mutations like BRCA1 and BRCA2. Asterisk, 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 hormonal factors like early menstruation, late menopause, and hormone replacement therapy. Lifestyle factors. Asterisk, asterisk, alcohol consumption, physical inactivity, and being overweight after menopause. The power we have lies in addressing these. Maintaining a healthy weight, staying physically active, limiting alcohol, and crucially, getting regular screenings as recommended by your doctor. These actions are backed by mountains of evidence and can truly impact outcomes. Worrying about an unproven risk can distract us from the powerful, proactive steps we can actually take. So, where does this leave us? After decades of research, the consensus in the global scientific and medical community is that there is no causal link between deodorant or antiperspirant use and breast cancer. The choice to use them, or to seek out natural alternatives, is now just that, a personal choice. You can choose based on preference, skin sensitivity, or environmental concerns, but you can likely stop choosing based on fear. Science isn't about declaring eternal, absolute truth. It's about following the evidence where it leads with rigor and humility. And to date, the evidence leads us away from the deodorant aisle as a source of danger, and toward a more nuanced understanding of a complex disease. The greatest tool we have in the face of any health scare is not panic, but information. And with that information, you can step forward with a little more clarity and a little less fear. Asterisk, please click the subscribe button.